And for more on the Delta variant and the COVID-19 pandemic, let's bring in ABC News medical contributor and Chief Innovation Officer at Boston Children's Hospital, Dr. John Bronstein. Dr. Bronstein, thanks for being here. As we mentioned earlier, the U.S. is recording more than 100,000 new cases in a single day for the first time since February. And Dr. Fauci has warned that things are going to get worse. So how bad is worse? Could we be headed back into lockdowns?
You know, I think it can definitely get worse, unfortunately, because this Delta variant is gaining momentum. But I think it's going to be the other sort of public health interventions that we're going to come into play: masking, social distancing, things that people are not excited by, but not the major sort of interventions like lockdowns. Lockdowns are extreme. And I think at this point, as the vaccine is rolled out, we recognize that we can be more targeted and focused in our interventions. Also, you can't look at the country in a uniform way. It's the pockets of unvaccinated people that continue to be the main host for spread. So it's these unvaccinated communities where you have lots of mobility, reduced mask use. Those will be the surges. And unfortunately, we have like tens of millions of Americans with no prior immunity that will succumb, to infection from this Delta variant. And, if you look at the models, and I know we're excited by the UK because they are seeing a dip, but, we are not quite at the vaccination levels of the UK. And so the models now show that we could end up with a surge in the fall, especially in the Northeast. And so, of course, places with better vaccine rollout, you're going to start to see decoupling. Cases might go up, but you might not see hospitalizations and deaths. But, at the same time, that tells us that we need to pick up this pace of vaccination. We can prevent that surge, that even greater than we're at now, by just increasing vaccination. But overall, blanket sort of recommendations and lockdowns are probably not going to happen. It's all going to be about flexibility and targeted interventions. And that might include large indoor gatherings that are probably going to be ones that we might focus on removing in the short term.
Now, hundreds of concert goers attended Lollapalooza this past weekend. 90% of them were vaccinated. Now officials are monitoring for possible COVID spread there. Do you think attending a crowded event like this, if it's outdoors and if that many people are vaccinated, is that safe?
I would have maybe said, thinking about outdoor gatherings, a few months ago made sense. But honestly, right now with Delta emerging, seeing those pictures out of Lollapalooza is essentially an epidemiologist's worst nightmare. We have 100,000 people. You only have about 90% vaccinated. So you still have 10% unvaccinated. Yes, you have to prove your testing, but, of course, we know that there is potential for spread among vaccinated people, especially given the information we're seeing out of Provincetown. So I do have real concerns. Yes, they were great at implementing safety guidelines, vaccine cards, testing requirements. They were pushing masking. But, I do have this concern. You have people coming from all over into a place, and you have neighboring states with surges, right? So you have places like Missouri and Louisiana, people coming in. And so you have this concern about, an increase in cases in Chicago, which has already seen a 5-fold increase. And then you have the concern of people returning back to their communities that may be unvaccinated. So I have a worry. We've seen this play out before with other music concerts. I do have a worry about what we'll see from Lollapalooza. And of course, that will inform how we think about, concerts going forward this summer and into the fall.
And the CDC says while someone infected with the original strain of COVID-19 is estimated to infect an average of 2 to 3 people in close contact, they say that number could be up to 9 people for someone with the Delta variant. What does that mean for how we fight this? And do vaccines change that?
Yes, vaccines absolutely change. And I want, you have to put that number into context. That is someone that's unvaccinated, someone that's not social distancing, someone that's not masking. So that number is definitely one that, we're seeing a headline around, but it doesn't mean that is every single case. Yes, Delta increases your likelihood of spreading. We know that you release more virus in the air when you cough or sneeze. And so that's the concern here, that you are more transmissible. And yes, we are seeing more breakthrough infections. I do have to caveat, there's a lot of discussion around Provincetown. That's a very particular environment with a very particular set of people that were in close proximity in bars and clubs. So it doesn't necessarily translate to other environments. And we have to remember, this still shows that the case for vaccination is so strong. Provincetown would have been way worse without the vaccine. We didn't see any deaths. We saw only 1 hospitalization. And so again, for the unvaccinated person, all this information about Delta says there's an urgency to go out and get the vaccine. But if you're vaccinated now, you should feel really good that these vaccines are protecting you against what matters, which is severe illness and death.
And Israel has started giving booster shots. We just heard the UK is planning to do the same. So do you think we could expect to see booster shots in the U.S. soon?
I think that's, the CDC is looking at this, and I think there is a possibility we might see this for a subset, but they're taking their time. They want the right amount of data. And so we have to recognize that, boosters may be, useful for those who are immunocompromised, people that can't mount, an effective response to the existing vaccines. There's a subgroup of people where we're seeing, this increase in breakthrough infections. And for those, vaccinated and in the hospital, oftentimes those are mostly immunocompromised people. So we may see the CDC make a recommendation for a specific group in the coming weeks. I expect that likely to happen. But again, I think the stress here is the vaccines are working. And I don't want this conversation about boosters to undermine what we know now, that these vaccines are working. We heard from a colleague in Louisiana saying, the majority of people in hospitals right now are the unvaccinated. And so we have to keep stressing that in order to do what we need to do, it's pushing the vaccine to those who need it. Those are the unvaccinated ones. And at the same time, recognizing it's all about global equity. If we have a stockpile of vaccines, we should be making sure that the whole world is taking advantage of these vaccines, because that's really how you end a pandemic.
All right. Dr. John Bronstein, always great to have you. Thank you.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.